So if you're going too deep in someone with really thin skin, what they're trying to do is tighten the SMAS, the supramuscular aponeurotic system. The SMAS sits, if I go through the different layers of the skin, you have your epidermis, the dermis, the fat layer, and then the SMAS. The SMAS is what we lift in a facelift. So in a deep plane facelift, when I'm going in, I'm elevating deep to the SMAS and then lifting the SMAS up in a more superior position. And so you can't really have a facelift like results without having a facelift, unfortunately. But a lot of people are trying to deliver those type of results. So if for instance, if someone is going 4 millimeters in the upper face here, trying to get deep to this mass, you're gonna bypass that fat layer and melt it because that heat will melt the fat layer. So definitely with Morpheus8, you can melt fat and thin out some of the skin, which we don't want in the upper face, especially up here. There are certain instances where someone may have some fullness underneath their chin or even a jowl, where I can actually contour along their jawline with the Morpheus8 going a little bit deeper. But it's pretty rare that I go deeper than 2 millimeters if I'm treating someone with thinner skin and not a lot of fat in their face. I actually have my facelift patients do a series of Morpheus8 before a facelift, because what I find is, after we lose 1 to 2% of collagen and elastin every year, starting in your 20s, by the time you get to the point of needing a facelift, your skin is very thin and elastic. And sometimes, as I am manipulating the skin in surgery, we're holding it with tiny forceps and skin hooks, and it can be so thin that it's very hard to hold. And when that happens, also after surgery, you can have some like rebound relaxation and a little bit of skin laxity after surgery. So if I pre-treat the skin, even with one treatment, a Morpheus, but certainly after 3, I notice that the dermis is a lot thicker and stronger, and I'm able to reposition the tissues in a much better way where you don't get that rebound laxity afterwards. So some people are saying that Morpheus8 shouldn't be done before facelift, but if used with the right settings and the right depths, I have not seen a problem with it at all. But if you're going too deep, certainly that can be an issue.